Cervical cancer remains one of the leading causes of cancer-related deaths among women in Uganda, but health authorities say the disease is largely preventable through early vaccination against the human papillomavirus, HPV, the main cause of cervical cancer.
When you look at our statistics in our country, women who are dying in this country because of cancer, and the cancer is on the rise. Cancer is increasing exponentially. Cancer is increasing. It is a big concern. All forms of cancer are increasing daily. But one of the biggest killer of women, as far as cancers are concerned, is cervical cancer.
Uganda has now introduced a single-dose HPV vaccine for girls, replacing the earlier two-dose schedule.
Research was done and we found that whether you give 1 dose or 2 doses, the protection is the same. So now we are giving 1 dose. So that let mothers know that they don't have to take their children again to get a second dose. So we changed it to 1 dose. That is a message we wanted to communicate to mothers, to the parents in Uganda.
The vaccine is targeting girls aged 10 to 14 years.
The purpose of us immunizing at 10 years, we do believe that at that age, children are not yet exposed to sex, but also that we believe that once we immunize all our girls at 10 years, that whole generation is protected. So if we continue doing that year after year, all our girls will be fully protected against cervical cancer. So in future, that can be a disease that we tick off.
Cervical cancer develops slowly and often shows no symptoms in its early stages, making prevention critical. By blocking HPV infection, vaccination stops the disease before it starts, reducing the burden on families and the health system.
Having those vaccinations will reduce your risk of developing that cancer. But even more than that, it's important for us to have routine screening because we are exposed to so many risk factors that it may not be possible for you to avoid all of the risk factors all of the time.
It is an expensive disease to treat. Once you get cancer, any form of cancer. So if there is a way to prevent that backlog from occurring, that will save government a huge amount of money to offload that burden.
The Ministry of Health is urging parents and guardians to ensure eligible girls receive vaccine, describing it as safe, effective and free of charge at public health facilities and outreach points.
It's an ongoing thing and requires a lot of engagement, especially if you talk about schools, especially in private schools. You have to do a lot of engagement with Ministry of Education, with the school owners, with the PTAs, some still decline to allow the teams to go to the schools. Therefore, they get the vaccination from the health facilities.
And the vaccines are available. Government has made the vaccines available in all our government facilities. And we want also proactive engagement of the private school owners to allow this program to go in the facilities to make sure, in schools, to make sure that those children who go to the private schools are given equal opportunity to get the vaccines. Because it's still, if we don't have 100% coverage, then we will not sit back and relax that we have dealt with cervical cancer, because it's going to come back.
Health officials say the success of the single-dose HPV vaccine could be a turning point in Uganda's fight against cervical cancer, shifting the focus from treatment to prevention.
But the process, by the time the vaccine hits the market, it has gone through all safety efficacy tests. They start with small groups, clinical trial, phase 1, phase 2, phase 3, until it is rolled out. And then we do pharmacovigilance, where we follow through anyone who has got that vaccine to study on a long term to see what are the effects. So studies are done before the vaccines are put on the market. So we just want to amplify the voice. 7 years ago, we were at $3.5 million US. We've been increasing. This year, government committed 8.1. Next year, I think, next financial year, we are going to have 8.5 million US dedicated to vaccine.
Walter Mwesigye, NTV.